Hi.
Hi.
Today let's learn few terminologies under food technology, deficiency and disorders. What is cachexia? It refers to loss of weight, muscle atrophy, tired feeling, fatigueness, weakness and significant loss of appetite in someone who's not actively trying to lose weight. Calloused fingers. This may be an indicator for self induced vomiting caused by repeatedly using the fingers to induce vomiting. They are calloused fingers. Okay. Cardiac arrhythmias. See, we are defining everything with respect to, concentrating more on nutritional deficiencies. So, cardiac arrhythmias could occur due to other causes also, but here we are concentrating on nutritional deficiencies induced cardiac arrhythmias. What could be the reason, etiology? So, cardiac arrhythmias are also called dysarrhythmia or palpitations, irregular heartbeat caused by abnormal electrical activity. It's a potentially life threatening complication of malnutrition and weight loss in anorexia nervosa or chronic purging in bulimia nervosa. So, severe weight loss causes thinning of the heart muscles, starvation, fluid imbalance, or chronic purging may lead to serum electrolyte or fluid imbalance. These complications will impair cardiac function and output. Common signs of arrhythmia include slowed or abnormal heartbeat, low blood pressure, shortness of breath, chest pain, dizziness, and or fainting. Untreated arrhythmias can also lead to cardiac arrest or sudden death. What is central obesity? It refers to the excess fat around the abdominal area, including around the vital organs such as heart and liver. What is cholecystectomy? It's a surgery to remove the gallbladder to treat symptomatic gallstones. What is chronic fatigue syndrome? It's a crippling fatigue related to a weakened immune system. Okay. Um, Actually, eating disorders and a weakened immune system may chronic fatigue syndrome is commonly seen. Diagnosis of any of these conditions would exclude a definition of CFS, that is chronic fatigue syndrome, unless the condition has been treated sufficiently and no longer explains fatigue or other symptoms. Now, what is Clostridium botulinum? Some vegetables, some tomatoes, figs, or all the non veg stuff, meats, fish, seafoods, and some dairy foods, they are low in acid. So, to control the bacterial invasion on these foods, we need to control all risks of botulism by uh, heat processing in a pressure canner. You have to tightly put it in an airtight container and heat processed in a pressure canner, and also acidify this food to a pH of 4.6 or lower before processing in boiling water. So this way we can avoid Clostridium botulinum, which is an infectious infection on these vegetables. Okay, so we cannot consume them. If we consume, we'll also suffer. Now, what is colectomy? It is the removal of part or the entire colon. What is constipation? It's a condition in which there is difficulty in emptying the bowel due to hardened feces. There is a bowel movement fewer than 3 times per week. जैसे हर दिन सुबह हम नेचर कॉल अटेंड करते हैं एंड वी ऑल्सो use the toilet, right? But if a person cannot do freely every day and he has to pass only once or twice in a week, then it is called constipation. Okay, and usually the stools are very hard, dry, small in size, granular, and difficult to even defecate or eliminate. The individuals may experience colicky pain, straining, bloating, and the sensation of a full bowel. Constipation may be experienced during the acute period of an eating disorder as well as during recovery also. It is associated with malnutrition, restricted intake, and purging. It may also follow laxative abuse. So, जरा जो continue laxatives खाते रहते हैं and to clean their system. So, this can also eventually follow. So, it typically improves with consistent nutritional intake and weight and nutritional restoration. Okay, if you gain weight naturally by taking nourished diet, okay, then a proper intake, then automatically it will get corrected. Dietary interventions can include consumption of adequate fluids, fat intake, food or nutrition, fruit and fiber. Now, what is dehydration? This is a condition where it occurs when body water loss exceeds the intake. जैसे हम पानी पी रहे सिर्फ सारा दिन में एक बार या 2 दिन में एक बार, और पानी निकल रहा है शरीर से बहुत ज़्यादा, then dehydration will follow because there is fluid imbalance. Dehydration occurs when the body loses water than how much you're consuming, than water consumption. So, this generally occurs due to insufficient water consumption or increased water loss due to vomiting or diarrhea or excessive sweating during summer. Symptoms include thirst, headaches, dry lips, lack of concentration. Mild dehydration can also occur before you notice any symptoms. What is gastroparesis? It is delayed gastric emptying. It's a condition associated with malnutrition and compensatory behaviors in which the stomach takes longer than typical to digest or empty the food. So, this causes premature satiety sensations due to abdominal discomfort from bloating, which can make refeeding uncomfortable. Symptoms include feeling full quickly while eating, nausea after meals, vomiting, and heartburn too. Abdominal bloating and or pain. It typically improves with consistent consumption of food, stabilization of weight, and cessation of compensatory behaviors. What is diabetes mellitus? It's a disease caused by the inability of the body to control the amount of sugar or glucose in the blood. So we have type 1 diabetes, which, and another one is type 2 diabetes. Type 1 basically results from body's inability to produce insulin in the pancreas, while type 2 diabetes is due to the body cells developing resistance to insulin. What is diabulimia? It's again an eating disorder in which people with type 1 diabetes deliberately reduce insulin treatment for the purpose of weight loss. Okay, the body goes into a starvation state, resulting in breakdown of muscle and fat into ketone bodies and subsequently keto acids. The body is unable to process sugars that have been consumed, so the sugars are excreted rather than being used by the body for energy or stored as fat. This typically results in significant weight loss but also places the patient at a risk of a life threatening condition known as diabetic ketoacidosis. What is disordered eating? It's a DSM 4 term to describe irregularities in eating patterns and behaviors. Disordered eating can develop into an eating disorder or remain relatively static with no progression in the short term. Not all people with disordered eating have an eating disorder. Okay, just because हम कुछ ज़्यादा खा रहे, that doesn't mean we are suffering from eating disorders. Eating, it's a DSM-4 term. Okay, so disordered eating can develop into an eating disorder. That is, few people खाते 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 they can go into some disorder. Okay, ज़्यादा इसलिए कुछ भी नहीं करनी चाहिए. Nothing, you shouldn't eat too much or too less. It should be just right. Okay, now what is dysomnia? Again, dysomnia is a sleep disorder in which patient suffers from changes in the quantity, quality or timing of sleep. This is commonly reported in patients suffering with eating disorders. In anorexic patients, this may relate to low fat of the sleep. Okay, so with this, we'll finish today's basic terminology class.